A new senior oral health report shows Americans regret not taking better care of their teeth, but 80% still aren't doing enough. So let's welcome in Sarah Chavarria, president of Delta Dental Insurance Company.
So we surveyed Americans 50 and older across the United States. 72% say that they wish they would have taken better care of their oral health when they were younger, and they still aren't doing it. So 80% are still not going to the dentist twice a year to get that checkup and that cleaning and take care of that. And we know that oral health is a window into our overall health. And so it's really important to get those checkups in.
And how does oral health impact people's lives?
I want to talk about one of the ways it impacts lives that came out in the report. So there's this connection with overall health, but there's also this incredible connection with our emotional and our mental well-being. And we found that 2 in 5 people saying that they're not smiling as much as they did when they were younger. And 30% of Americans 50 and older are saying that they're missing out on making connections because they're embarrassed to laugh or smile. And with the pandemic really starting to be behind us, having those connections with family, friends, even new people is so important. So we want people smiling.
Right. That smiling is important, and it's important to your health. So what are some of the barriers that are keeping us from prioritizing this oral health? And are there certain communities that face disproportionate barriers?
Absolutely. So one of the top barriers is what we've been talking about, and it's just a basic lack of understanding about this connection between oral health and overall health. Another barrier is the access. So think about the time and the mobility and the transportation. That's a big one. And then the third one is just those negative emotions people have associated with going to the dentist. And so those barriers, we see that gap really widen when we're looking at our Hispanic and our Latino communities. We're looking at our African and Black Americans. When we look at those populations, we see that even more as a barrier. And so I'll just say it's really, really important that we find ways to close those gaps and help people get that access to quality care that they need and deserve.
Well, thank you. And what can people do to improve their oral health?
Well, so we subscribe to the 2-1-2. So brush twice a day, floss once a day, see your dentist twice a year. Super important. Also, drink a lot of water if you can with fluoride, eat healthy snacks. Make sure you're getting out there and doing a little bit of exercise. It's good for your overall well-being. And also, if you wear a partial or you wear a denture, make sure that you're taking that out and you're cleaning it and really giving your mouth a break.
Right. So we can smile nice and bright and feel good at the same time. Now, where can viewers and listeners go for more information?
Please go to ddins.co/healthy aging. You'll find a lot of resources there and lots of information about getting that access to care.
Thank you, Sarah. And we're going to keep on smiling. Have a wonderful day. And of course, you can head to our website, and that's firstcoastliving.net.